believe this is the first meeting of the January as we're meeting as a committee, so we are operating under some new rules and regulations. So just reminder that we all need to be visible on camera um, at all times. So we need to ensure that we have that turned on. I know we're also waiting on Jessie. She's probably having some technical difficulties, but just for the sake of time, I'm going to get started as my opening blurb, as we do have quorum. Thankfully, Jason is here, so we are able to get on. So welcome to the January 22nd, 2024 Licensing Committee meeting. My name is Sung Oh, Chairperson of the committee. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. As I facilitate this meeting, I will announce when we are accepting public comment. I have advised the meeting moderator to allot 3 minutes to each individual providing comments. We will begin with public comments for individuals attending in person, followed by public comments by individuals participating via WebEx. This approach is necessary to facilitate this meeting. Before we get started, I would like to ask staff moderating the meeting to provide general instructions on the process for providing public comment via WebEx.
Good morning, this is the moderator. When public comment is requested, I, the moderator, will turn on the WebEx question and answer feature to facilitate this. Comments should be limited to the topic that is addressed in that specific agenda item. We will have instructions displayed on the screen each time, and members may click on the question icon, typically at the lower right-hand corner of their WebEx screen, type the word comment into the text box, and then click send for their request to be recognized. You may also choose to raise your hand by clicking on the hand icon at the bottom of your computer's WebEx screen, or if you're an audio-only participant, you may press *3 on your device to raise your hand. You will then be given 3 minutes to speak with a 10-second warning, and at the end of that time, your microphone will then be muted, and we will move on to the next commenter. I believe that is all the instructions I have, and it does look like Ms. Crowley joined us.
All right, Jesse, just we do need the cameras on, and if not, I do believe we need to make a quick statement explaining that the technical failure you're experiencing. Corinne can, oh, there you are. Thank you.
Yeah,
All
sorry, I'm
right.
here. I was having some technical difficulties.
No worries. Yes, it happens to the best of us. It's raining in San Diego, so you might, hopefully I'm not going to have any issues here with connections. So I'd like to take a roll call to establish a quorum. Trevor Chandler is not here today. Renee Barker.
Good morning, licensee member present.
Good morning, Renee. Jesse Crowley.
Licensing member present.
Good morning, Jesse. Jason Wise.
Morning, Jason Wise, public member.
Good morning, Jason. Thank you all for being here. A quorum has been established, members. We have a full agenda for our meeting today. I ask everyone participating today to be respectful of the work before the committee today. We encourage participation by members of the public throughout our meetings at appropriate times. The committee respectfully requests that when comments are provided, they're done so in a professional manner, consistent with how the committee conducts its business. Next, agenda item 2, public comment on items not on the agenda or agenda items for future meetings. I will now ask the moderator to open the line for individuals to provide the opportunity to provide public comment. You're not required to identify yourself, but may do so. I'd like to remind everyone that the committee cannot take action on these items except to decide whether to place an item on a future agenda. Members, following review of the public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the committee and the public to request consideration of an item for future placement on an agenda, at which time the discussion may occur. I don't see anyone in the public in Sacramento. Can we just confirm that, Anne? Don't think I hear them, but I don't see anyone. There may be a microphone difficulties again there, but I'm gonna go for WebEx in the meantime.
All right, this is the moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment for items not on the agenda, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. And it does look like a request for comment from Jackie Stover. Jackie, you will be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Stover. I am a specialty pharmacist. I just wanted to say once again, thank you to the licensing committee, specifically Jason Weiss, for writing the updated amendment regarding remote processing. I understand at this point the amendment is pending an author to sponsor the bill. I am curious if there is anything that we can do to help expedite this process. And also, how would we know once an author has been found? Thank you in advance.
Thank you for the comments, Jackie. And I'm not seeing any other
Yes,
public
it appears there are no
comment.
further requests for public comment. Would you like me to close the Q&A panel?
Yes, please. Thank you, Sarah. And I am getting a confirmation from Sacramento team that there are no public in Sacramento. So with that, members, any comments? Seeing none, I will move on to the next agenda item 3. Approval of October 18th, 2023 committee meeting minutes. Members, as we begin our consideration, I'll ask members if you have any questions or comments from the minutes from the October 18th, 2023 meeting. I would also entertain a motion if you believe such action is appropriate, members.
Hi, Sung, this is Jessie. I'll move to approve the minute.
Thank you, Jesse. Anyone second Jesse's motion?
I'll second that. This is Renee.
Thank you, Renee. With that, with a motion and second, I'll now open the discussion for public comment on the October 18th, 2023 draft minutes. I still don't see anyone in public in Sacramento, and we're going to go for WebEx public comment.
This is the moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. I'll pause a moment to allow the public time to access these features and submit their requests. All right, and seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you. All right, with that, we're going to go for vote. Renee, how do you vote?
Yes.
Thank you, Renee. Jesse, how do you vote?
Yes.
Thank you, Jesse. And Jason, how do you vote?
Yes.
And I vote yes, the motion passes. All right, moving on to the next agenda item 4. This is where things get fun here. Discussion and consideration of draft survey related to pharmacist to pharmacy technician ratio. As you may recall, during our last meeting, I shared my intention to focus committee discussion on strategic objective 1.3 related to the exploration and pursuit of changes in law as appropriate for the authorized duties of a pharmacy technician. An important first step in this evaluation included this committee convening listening sessions and soliciting feedback from licensees regarding potential changes. The results of these efforts were incorporated in Assembly Bill 1286, which became effective on January 1st of this year. More recently, during our October committee meeting, we initiated a review of the board's ratio requirement. The meeting materials detail the current law related to ratios. As the meeting materials note, members routinely receive public comments indicating that California has one of the most restrictive ratios As a reminder, review of various state ratios does not necessarily provide an apples to apples comparison, as jurisdictions have varying approaches and provisions for services within a pharmacy, including where some jurisdictions require all pharmacy personnel to be licensed as a pharmacy technician if performing even basic functions such as data entry or order entry. This is not the case in California. I highlight this only to remind us that when comments are received, context matters deeply. The meeting materials highlight a few approaches taken by various states. While I'm not certain we will reach a recommendation for the board today, I believe this discussion, while very challenging with many competing interests, is also very important. During our discussion last meeting, we considered a number of policy questions related to the current ratio and potential opportunities for the change. After consideration of the policy questions and comments from stakeholders, members determined it was appropriate to solicit feedback from a broader audience of pharmacists through a survey. Attachment 2 includes a copy of the draft questions developed by staff. We were fortunate to have a DCA staff member with expertise in survey design assist with the development of the questions. From a process standpoint, after we finalize review of the survey, staff will work again with experts to finalize a survey, developing the introduction, and release the survey. It is my hope that this work can be conducted relatively quickly to allow results to be provided no later than the committee's July meeting. I had an opportunity to work with the staff on the development of the survey and believe both the approach offered and the questions are appropriate. I believe the data will assist us in our future policy development in this area in a broader ways. Members, do you have any questions or comments and also feedback on the surveys? Hopefully, we can kind of add any questions or comments, and then we can make a motion to incorporate those changes if you have any requests or anything that you would like to include. So please feel free to speak. And if you feel like the questions are appropriate as it is drafted, motion would be appreciated as well. And I would imagine we will hear significant public comment as well, possibly. So if you don't have any significant suggestions on changes, we can possibly make a motion and open up for public comments. Renee, go ahead.
Hello. Yeah, I think the survey is really well done. I think it covers a broad, just a lot of questions and a lot of opportunity to determine practice settings. I did so just to kind of throw out there. So for question 3, so if the primary practice setting is located in California, I mean, this is probably splitting hairs, but I'm just going to say it. If somebody has some other job in another state, like, I mean, because what we really want is the feedback about a pharmacist working in California. I
Right.
mean, I think we know we have a lot of registered pharmacists, and I think there's lots of situations. And so I think something that really specifies their practice in California. And then there's another one, it's just more of the, which one was it? It has, sorry, I moved there's a question that asks something but only gives yes or no answer. Sorry, where is it? Sorry, I'll find it.
Okay. Yes, I'll get back to you, Renee. But
Yes,
on
thanks.
question
Sorry.
3, it's probably best to emphasize that what we are soliciting is for people who are working in California, right? That's, yeah, okay. All right, Jesse?
Hi, Sun. Thank you. And thank you for staff for putting this together. I think this is a really thorough survey. One of the questions I had was in regard to question 8 I think the wording is pretty confusing where it says, does your work site currently use pharmacy technicians to assist the pharmacist in the pharmacy with the performance of pharmacist duties? I'm not sure
Yes.
what that question means, and I think that's probably going to be confusing for anyone who's reading it. So I think we could probably rephrase that
Just
question
leave
so
it.
that it's a little
Yeah.
more clear.
Yes.
I
I think,
also had another question.
yes,
Oh,
go ahead.
sorry, go ahead. Oh,
You're
and
right.
I also appreciated the open-ended question at the end so that people can add whatever comments they have.
Got it. And for Renee, I think it's question 7, right?
Yes.
Yes.
Yes,
Okay.
that's it. I just found it as well. Uh-huh.
Yeah. Okay. And then I'll go to Jason.
Thanks, Sung. I just wanted to thank staff for the preparation of the survey. I thought it to be thorough. I'm glad that we did flag that this is primarily seeking input from pharmacists in California. I think that's important, so thank you.
Thank you, Jason. Okay. So just I think that these comments are something that we can incorporate before the full board votes. So if anyone would like to make a motion to incorporate these changes and Anne can make the changes, Corinne, I hope that motion would be significant for us for our discussion. Anyone would like to make a motion on that? So that we can proceed.
Sung, this is Jason. I'm happy to make that motion.
Thank you. And any second?
I'll second. This is Jesse.
Thank you, Jesse. With a motion and second, we're going to open up for public comment. I would imagine there may be some changes after. So let's see if we have any public comment. And I still don't see anyone in Sacramento, so I'm going to move on to WebEx. I'll just go to WebEx unless I hear otherwise from Anne. So we save the time.
This is the moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. I'll pause a moment to allow the public time to access these features and submit their requests. All right, it does look like we have a couple requests in the Q&A, so I'll go in the order they received. First, I have Keith Yoshizuka. And Keith, you will be given 3 minutes to speak and a 10-second warning. Please click the Unmute Me button when the prompt appears on your device.
Oops, am I muted?
You're unmuted.
Oh, okay. It may be premature, but in as much as it takes a while for the process to occur, may I suggest that the board consider sponsoring legislation to allow the board on its own to establish regulations to establish the tech-to-pharmacist ratio rather than having it embedded in a statute, similar to the way that the ratio is established for inpatient technician to pharmacist ratio. That way, rather than having to go back to the legislature each time as the board deems it appropriate, it may on its own establish regulations to modify the ratio. Thank you very much.
Thank you for the comment, Dr. Yoshizuka.
All right, this is the moderator. Next, I have Lori Walmsley. And Lori, you'll be given 3 minutes to speak and a 10-second warning. Please click the Unmute Me button when the prompt appears on your device.
Walmsley on behalf of Walgreens, Director of Pharmacy Affairs. Overall, I think the survey looks pretty good. I do have a suggestion on amending 2 of the questions, question number 19 and question number 20, where it says that no, I don't believe the ratio is is sufficient, I would suggest adding one additional option here in addition to the 1 to 2, 1 to 3, 1 to 4, and other. I would suggest perhaps amending to add another question that would allow the pharmacist in charge to determine the ratio. As we look at what's happening with practice across the country, there are so many different types of practice settings, and to allow the PIC to make that decision, like you have with other things, I think is an opportunity for the regulation for flexibility within the environment versus having a strict number, especially since it does take quite a lot to obviously change a rule and things like that. And there are a number of different circumstances which a PIC might decide if they could supervise more or less based on the the functionality and the skill level of their technicians as well as the specifics of their practice. So appreciate the consideration and thanks for your time.
All right, thank you for the comments, Lori.
All right, this is a moderator. Appears there are no further requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you. Thank you, Sarah. Jason, would you be open to changing the motion to add question 19 on 1020 to add determined by PIC as one of the options?
Yes, that works for me, Sung.
Sounds good. Thank you. Jesse, are you okay with that? Second?
No, I'm okay with that.
Okay, sounds good. All right, with that, I'm gonna have to probably open for public comment one more time. Sarah?
All right, this is the moderator, and at the direction of the committee, I've once again opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. I'll pause a moment to allow the public time to access these features and submit their requests. All right, and seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you. All right. So with that, we're gonna go for votes. Renee, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jason, how do you vote?
Yes.
Thank you. And I vote yes, the motion passes, and we will have an opportunity to look at this one last time at the full board meeting, and then we will release the survey after that. Next, moving on to agenda item 5, discussion and consideration of proposed amendment to California Code of Regulations, Title 16, Section 1707.4, related to central fill pharmacies. Members, as I mentioned during our last meeting, Strategic Objective 1.2 calls for the committee and board to consider and pursue necessary changes in the law regarding various pharmacy practice settings to ensure variances in the practice are appropriate. Today, we have the opportunity to continue our discussion and consideration of proposed changes to the board's regulations regarding central fill pharmacies. The development of the proposed changes reflects our discussion and consideration of several policy questions contemplated during our meeting in October of last year. Attachment 3 includes a copy of the draft proposed regulation language. I had the opportunity to work with the staff on the proposed language. I believe it is appropriate, reflects our discussion, achieves the clarity sought by the regulated public, and provides for appropriate consumer protection. Of course, I'm open to suggestions for any amendments. And members, I would welcome your thoughts on the proposed language. And it is in attachment 3. So it is quite a change. Okay, starting with Jesse, go ahead.
Thank you, Sung. I think overall the language is really good. It makes it much more clear that central fill pharmacies control both original fills and refills. My one question is actually in regards to the final verification portion that was added in. And just wanted to have a discussion on the review of photographs for final product in lieu of physical verification. The impression I got from the last discussion is the need for at least one pharmacist to actually have a tangible final verification with it. So I just wanted to open that discussion to see what everyone else's thoughts were with this portion.
Okay. Any thoughts on that, Renee or Jason? I am very open. That part for me, it was really like I'm okay either way. So I'm okay with any direction that you all want to take on that. And maybe it's best that we can also open up for public comment for some of the comments. But it's up to you guys. So Renee and Jason, any thoughts on that, on the final product verification piece? It's under 5. It's under A5.
Yeah, this is Renee. I mean, similar to what Jesse just said. Just not. I'm. You know, again, it's not my practice setting, but I would be curious how that would really play out. And I agree with you that I wonder what kind of comments we'll get that might help with some clarification. But I
can
would
open for
agree
public
that some other check agreed, but what that looks like, not sure.
Okay.
Yeah, I don't disagree with this one, but I'm just wondering if there's something that
Yeah.
could be better.
Maybe best that we open up for public comment. I don't think that that's going to be a problem. So I would hopefully that our public can help us with that, some of the thoughts on that. So let me open up for public comment, Sarah, and we'll try to get some input and then go from there.
All right, this is the moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. And it looks like we do have a request from John Gray. John, you'll be given 3 minutes to speak in a 10-second warning. Please click the Unmute Me button when the prompt appears on your device.
Hi, good morning. This is John Gray, registered pharmacist with Kaiser Permanente. Thanks for the opportunity to comment. Again, just want to be very clear with the board that at this time within California, we don't, Kaiser Permanente doesn't engage in central fill pharmacy practice to any significant degree. But a couple comments just for you all to consider. First, on the question of allowing the pharmacy the flexibility to have pharmacists working at the originating pharmacy perform final product verification, reviewing photographs. We would be supportive of including that language to allow pharmacies the flexibility to have, varying practice models, which might include the practice of using photographs to do the final product verification. And I think giving pharmacies that flexibility feels consistent with the board's kind of previous approaches to final product verification, in that, in the past, the board's view has been, it's the pharmacy and pharmacist's responsibility to prepare and dispense a prescription that does not vary from the prescription that was written. And regardless of how you perform final product verification, if there is a variation from the prescription, then the pharmacy law has been violated and the board can investigate. So whether you look at a photo or hands-on check the physical product, traditionally the board's view has been if there's variation from the prescription, then the pharmacy law has been violated and you can investigate and take appropriate action. The other comment I'd like to provide is, the existing regulation uses the term originating pharmacy, and the proposed changes add another reference to originating pharmacy in A5. So I would just suggest looking at whether there are opportunities to carry that term originating pharmacy throughout the regulation to ensure that it's crystal clear which pharmacy is the originating pharmacy. So for example, in sub A, you could consider saying a central fill pharmacy located in California and licensed by the board may process a request for prescription medication received by another pharmacy, comma, the originating pharmacy, comma, within the state. And then similarly at the bottom where you define the term central fill pharmacy, you might say,
10 seconds.
at the end, prepares and packages prescriptions for another pharmacy, comma, the originating pharmacy to dispense to the patient. Thanks very much for the opportunity to provide comment.
Thank you for the comments, Dr. Gray.
All right, this is the moderator. Next we have Lori Walmsley. And Lori, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Hello again, board members. Lori Walmsley, Director of Pharmacy Affairs on behalf of Walgreens. Thank you for the opportunity to provide comments. First off, I appreciate the board's continued discussions on the topic of central fill. I appreciate the clarity around adding the language that would allow for new and refill prescriptions, but I do have a couple of suggestions for potential change. My first recommendation is to amend sub A to allow for a California licensed pharmacy to participate in central fill versus one that is located and licensed in California. There are likely a number of pharmacies that are currently providing service into California using central fill services. Walgreens does not, but I do believe that there are others. And it would be very unfortunate to disrupt services that are currently being provided safely into the state right now. So I would encourage you to look at that language so that you don't provide any disruptions to patients as an unintended consequence. My second recommendation is to remove the language that is added in sub 5 to kind of to Jesse's point, the recommendation to have the pharmacist at the originating pharmacy perform final verification defeats the purpose of centrally filling a prescription when the goal is really to reduce some of the workload at the local community pharmacies or at the hospitals. In addition, potentially opening those products a second time could actually introduce an additional opportunity for error, which could actually be contrary to your goal of patient safety. And then thinking about how verification occurs today in a traditional community pharmacy or in a hospital for that matter, when one pharmacist is checking a product and another pharmacist is working at a later point in time, you don't require the other pharmacist to go back and check it. We need to trust the pharmacist that did the work upstream. And I think by removing that language, you're able to do that. There are record keeping requirements as a result of this rule as well, so you can still hold the appropriate person accountable based on the functions that they performed on that prescription. So I just don't think it's really necessary. And then lastly, I don't believe that we've really opined on the discussion around the verification, the final verification for products filled via automation. I think that sub 5 was attempting to potentially do that, but I don't know that that's the right way. So I would encourage the board to bring back future discussions on the topic of verification of products being filled by automation. So thank you very much for the time. I appreciate the continued discussions here.
Thank you for the comments, Lori.
Right, this is the moderator. Next we have Mark Johnston. And Mark, you will be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device. And Mark, you are unmuted.
CVS Health. CVS Health. The request to modify 1707.14 request from the public and no apparent issues that the board have currently exempt fill activities into California. Adding this new restriction would have severe operational implications without apparent justification. CVS Health is also opposed to draft language that requires the originating pharmacy to complete product verification. Simply stated, this defeats the purpose of central fill and renders the central fill model unusable. Additionally, central fill pharmacies may ship dispense prescriptions directly to the patient on behalf of the originating pharmacy. Again, this language renders a portion of current proven operations unusable without any apparent issues with it. Lastly, CVS Health is concerned that draft changes to 1704 7.4 to central fill may have unintended effect upon RV's central processing allowances. We were to those implications. In conclusion, central fill activities exist today, and these proposed changes drastically affect current operations without reported issues that justify wide-scale change. The board would benefit from education from current licensees who utilize central in and into California prior to moving forward. And we'd certainly be willing to participate in such education. Thank you very much.
Thank you for the comments, Mark.
All right, this is the moderator. Next, I have Stephen Gray. And Stephen, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
First, I'd like to congratulate the board on recognizing how important it is to allow central fill pharmacies to fill new prescriptions. Central fill was a way to use automated processes that are very important to improving the accuracy of the filling of all prescriptions. That can't be done in many cases by local pharmacies. They just cannot afford the capital investment and the maintenance of the automated processes. So this is very important to accuracy. I would like to point out that I think that the board, the board members and staff need to give some consideration to how this regulation modification interacts with Regulation 1713. Regulation 1713 indicates the places to which a filled prescription can be delivered, and it's been around for a long time, 30 or 40 years, and it basically says, except as provided otherwise, a filled prescription cannot be delivered other than to a place licensed as a retail pharmacy. That's paraphrasing it, but for years we have been able to deliver filled prescriptions to another licensed pharmacy, and it wasn't necessarily a central fill. And how does this now change that? If it does, and I don't think it was the intention, but that you need to give that some consideration. And the other thing, it indicates in the new language that pharmacists working at the originating pharmacy must perform final product verification. That's not required of mail order pharmacies. It's not required of prescriptions that were delivered under Regulation 1713. So again, I ask that that be considered. But also, if it's going to be kept, it needs to, think through it. And is there a record keeping requirement with that the originating pharmacy or the pharmacy to which it is delivered, that identity is maintained so that if there is an error, that it will be, something that can be identified and fixed as a possible way of improving the accuracy in the long term. Those are my comments. Thank you very much.
Thank you for the comments, Dr. Gray.
All right, this is the moderator. Our next individual who has requested public comment, Lindsay Gullahorn. And Lindsay, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Thank you. Good morning. This is Lindsay Gullahorn with the California Community Pharmacy Coalition. I will keep my comments brief. Do want to thank the committee for discussing this issue over the fall and for staff for drafting the language, and just echo the comments of Lori Walmsley and Mark Johnston. Have a couple of suggestions related to the draft. First, the language in subsection A limiting central fill to pharmacies that are located within California. This would be highly problematic given that for many of our members, I believe a significant amount of central fill happens outside of the state. So subdivision A again specifies that a central fill pharmacy located in California and licensed by the board may process a prescription received by another pharmacy in the state. This appears to limit the practice to only California pharmacies. Conversely, the new definition of central fill in subsection B defines a central fill pharmacy as a California licensed pharmacy, but does not reference that pharmacy being within the state. So we request clarification that central fill can be permitted both within and outside of California by California licensed pharmacies. And then last, with respect to the final product verification, again, the draft language specifies that pharmacists working at the originated pharmacy have to perform the final product verification prior to dispensing. And we would also request that this language be modified because requiring verification at a dispensing pharmacy takes away much, if not all, of the usefulness of central fill, even if it's being done by reviewing photographs. So we'd respectfully suggest that this language be modified somehow to preserve the current practice and avoid adding additional duties that hinder pharmacy workflow. Thank you.
The comments, Lindsay?
All right, this is the moderator. Appears there are no further requests for public comment. Would you like me to close the Q&A panel?
Yes, please. Thank you, Sarah. Thank you. All right, members, as expected, there's significant comments here and quite a few directions and challenges here to navigate. So let's just, there's a couple options we can try to discuss today, just a little bit of where else to go and adding and taking some things out. We don't need to, I mean, this doesn't have to happen today, so we can bring back for meeting in April, or if we can try to land somewhere in today's discussion, we can try to have a motion and proceed. So let's just start any pending thoughts that comes to your mind. Jason, I see your hand is raised. So go ahead, Jason.
Sure, thanks, Sung. I think that I don't know where we go from here if we ask staff to take this back and review, but I certainly don't want to cause any disruption in services from patients, California residents that are currently benefiting from this. So I think that's top level of my concerns. Thank you.
Absolutely. I think what would be helpful is that soliciting maybe some more feedback of the pharmacies utilizing it, because the reason why I was okay to draft this as it was drafted was my understanding that this is not that used heavily at this point in time, and also that there's not a lot of cross the border services that are providing central fill services at this time because of the legal ambiguity of it being not clear from the discussion we heard last time that there was not a clear allowance or disallowance of outside non-resident pharmacies performing central fill for California pharmacies. So that's why it was our attempt at clarifying that. So if there's any stakeholders out there that has information, it would be probably prudent for us to have that before we have a motion to proceed on that portion of it, because I would like to know more and keep soliciting for information on that. I please tell us where is it happening and who is it serving, because we would love to know, because currently, as far as I know, it was not that it was not happening. Jesse?
Thank you. Yeah, I agree. I'm honestly left more confused after hearing public comment. Even just the comment in regards to final verification, I was under the impression that Central Fill, the originating pharmacies, were already performing the final product verification. So I think we need some clarification on how many pharmacies are performing this, and more, I think we need more information on what the workflow currently looks like. I think the intention was really just to provide clarity on what was already being provided, and it seems like this language is providing more confusion, which we don't want.
Yep, right. So at this point, I think it's best that I see Marcus's hand is raised. So I'm actually, once we're done here with the comment, I'll open up for last final comment. I don't think that it's appropriate today for us to have a motion. So probably best that we take this back with the staff. Anything else that comes to your minds that are must here, or it's probably not ready for us to have that yet because we just need a little more information. Renee, your hand was raised. Did you have anything to add?
Yeah, I did appreciate a lot of the comments. Obviously, I think definitely providing more perspective. I think John Gray's comment about just maybe some clarification and using that language originating pharmacy in the places where it's being referenced and just stating it explicitly, because we are going back and forth talking about 2 pharmacy locations, right? So I think if that can help with some of the confusion. I think there were some other good suggestions, but I would also, it sounds like this, performing a final product verification, definitely, like, I mean, I think we've already discussed here, but really needs a look at because we don't need any duplicate work. I don't know if there's been a conversation about like errors that have gone undetected and would have been detected at this point. But there would also be, I think Jesse alluded to it, probably a trail of, tracking verification points along the way. I think as a pharmacist, I guess, so some of these are mailed directly to patients, so we're trusting that, or maybe that's why we're putting this in here. But in the instance where a pharmacist is dispensing something dispensed, like that came from a central fill pharmacy, there may be those that would want, for some reason, to be able to check the history of the fill. And I'm just wondering if that's available to them. I know they're busy, so I don't think they would be wanting to on a regular basis, but there could be some question. And I'm just wondering if they would, because, they will be along that trail of responsibility once it goes to the patient. So if they did want to double check something, if they had a concern, just wondering if that's available to them.
Yeah, that's a great comment, Renee. I think that's actually a great suggestion. All right. I think that this motion probably will not happen today, which is totally fine. We're not in a sprint to get this done. It's just trying to probably best to get it a little bit better and get it right. So with this, I know I'm just going to open up for one last public comment on this item just because someone was trying to raise their hand. So I'm trying to be respectful, and I'm going to open up for public comment one last time, and then we're going to move on.
All right, this is the moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. All right, it looks like we have a request from Stephen Gray. Stephen, you'll be given 3 minutes to speak and a 10-second warning. Please click the Unmute Me button when the prompt appears on your device.
Thank you again for the opportunity to comment. I applaud the ability or the decision to keep discussing it. I think it needs a little verification, and the board members really need to understand how these central fill pharmacies work. One comment I didn't have time to make, or I forgot to make, was it in the elimination of the current wording in subsection B as in boy, you have removed the words "or transmitted to it by a prescriber." And I don't think that that was really thought through. Central fill pharmacies, they also act as mail order pharmacies. They also act as originating pharmacies. And so I think that you might want to leave that in there, just keep the same language to realize that not all the prescriptions that are filled by a pharmacy that is also doing central fill might come to it from a prescriber or from the patient directly, as like a mail order pharmacy would, rather than be a central fill. The other comment I would make is just to give you the history and something to think through. And I think that board member Renee hit on something. The original central fill pharmacy in California, which was what this regulation was all about, the central fill was operating from a common database with all of the local pharmacies. So it had the advantage of also being able to see the refill history and do the DUR. The question comes up now in some minds, and I've heard other people comment on this, who's going to do the DUR on filling the prescription? And I think that needs to be discussed. I'm not sure that the language is inappropriate currently, but I think that has to be discussed. And obviously the local pharmacy, and I say local pharmacy rather than originating, they are responsible also for doing the consultation when it's required, and consultation can be required when someone has reviewed the profile, even on a refill. Thank you very much for the opportunity to comment.
Thank you for the comments, Dr. Gray.
All right, this is the moderator. Next, I have Lori Walmsley, and Lori, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Thank you, Lori Walmsley, on behalf of Walgreens. I would recommend the board potentially get some presentations on how central fill pharmacy works. It is quite a different business model, and certainly a practice that is widely happening across many states in the US. So would recommend a presentation to the board. Would be happy to provide that on behalf of Walgreens, or if there's others that you'd like to work with, can put you in touch with perhaps even our IT partner that we work with in other states for our other facilities. So do think that might be a helpful next step as you guys contemplate the policy a little bit further. Thank you.
Thank you. Thank you for the offer.
Right, this is the moderator. Next, we have Mark Johnston. And Mark, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Hello, this is Mark Johnston with CVS Health again. Thank you for the second opportunity to speak. I do agree with Lori, and as I originally said, I think the board could benefit from some education. I'd suggest inviting in companies that currently use central fill to explain their models to the board. It's really easy to think about central fill when it comes to retail pharmacies. One pharmacy fills a prescription for another pharmacy to increase efficiencies, etc. But the brevity of the current California law has allowed inventive solutions to complicated healthcare problems. There's many other models that utilize central fill currently, such as mail order and specialty. In the case of specialty pharmacy, I'd argue that the majority of the work and importance is on the front end. It's DUR, counseling, obtaining blood levels, communication with the patient. The filling of the prescription, while of utmost importance, is almost secondary to the front end in a specialty operation. And quite often that filling happens through a central fill model at a separate pharmacy. And that pharmacy may be located out of state, but the important aspects are generally located within California, or quite frankly, it could be vice versa. The central fill pharmacy could be in California, but the front end portion of the central fill process could be located out of state. Anyway, my point is that the current flexibility in the law has really developed inventive solutions that limit costs that ultimately go back to the patients, limit efficiency, hasn't shown to have any issues in California that I'm aware of. As was stated by members of the committee, I'm not in favor of anything that would drastically affect current operations. And I'd certainly be willing, and it sounds like others would be, to come to the next committee meeting and present on how central fill works in such a variety of different practice settings that might be enlightening to the board. Thank you for the second opportunity to speak.
Thank you. Thank you for the comments, Mark.
All Right, this is the moderator. We have a request for comment from Gary Swearingen. And Gary, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
I'll keep this short. We've been in California Central Fill for several decades. And it works well, and we would be happy as well to provide information on how we process these prescriptions, the workflow, and the scope of our activities in California. Thank you.
Thank you for the offer and thank you for the comments, Gary.
All right, this is the moderator. Appears there are no further requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you. Thank you, Sarah. Thank you, members, for this discussion. A lot more contemplating to do. So we'll definitely bring back this item for next meeting and possibly provide a presentation as someone's offered. So got a lot of work to do, and we'll bring you back for next meeting in some capacity. Next item is agenda item 6, discussion and consideration of proposed definition of mail order pharmacy. As I shared during our prior discussion on mail order pharmacies, I'm concerned about the board's inability to regulate non-resident pharmacies, including mail order pharmacies. Mail order pharmacies can create unique challenges for patients. I can recall at least one investigation that resulted in discipline stemming from these challenges that are placing patients at risk. Based on our discussion at our last meeting, there appear to be opportunities to improve our oversight of mail order pharmacies. As a first step, it appears appropriate to consider a definition of mail order pharmacy to ensure everyone has a common understanding. This could also create opportunities for the board to address its regulation of this business model more directly. I believe the definition is an important first step. If we agree with the definition, I suggest that at our next meeting we begin discussing if additional or different requirements should be used to regulate mail order pharmacies. As I mentioned before, I believe this issue may be appropriate for the sunset report. I would welcome your comments on the proposed definition of mail order pharmacies. It's an attachment 4, I believe. Any thoughts on that? At this point, there is no action item. This is just a preliminary discussion, so we don't need any motion. Jesse, your hand is raised.
Hi, thank you, Sun. Yeah, I do have a few questions generally. So I think, since the pandemic, we've seen a huge spike in medication delivery in general. So that can be from retail settings. A lot of retail pharmacies will use either the postal service or some sort of courier service. I'm not even sure at this point if retail pharmacies are tracking the percentage of prescriptions that are delivered. So I am curious what that 75% means. Is that like a daily percentage? Is that weekly, annual? How is that number going to be accounted for? And I'm curious to hear feedback to know if retail pharmacies even have a capability to track that, if their systems are currently tracking it, and if they have that data currently available. Also curious to see if this will somehow affect contracting with certain PBMs and insurance companies. If there's currently a pharmacy that, for example, identifies itself as a community pharmacy, but this new definition may mean that they're now mail order, will that affect their contracts with insurance companies and PBMs moving forward? And I think that's something that we should be mindful of as we continue this discussion and look to define it.
Thank you, Jesse. Excellent comments. Absolutely. I think that's something that we can incorporate into possibly amending it. Maybe put a time frame. Yeah, the PBM piece is absolutely a very valid concern. Renee?
Yeah, I just had wanted to make a comment. I thought it was a little more confusing, probably use more definition for that very last sentence. about more than 75% of prescriptions. I'm assuming that's that they fill entirely. Anyway, I feel like it's not very clear. So just adding that.
Would it help to put like a time frame within the last preceding year or something like that? Any suggestions?
Yeah, I mean, I suppose some time frame would be needed. That's a good point.
Okay. Okay. Jesse, did you have any? Oh, okay. All right. With that, let's open up for public comments. I'm sure we're gonna have some public comments on this as well. So let's go with public comment. And I don't see anyone in Sacramento. So Sarah, we're ready for WebEx comments.
All right, this is the moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. All right, it looks like we have a couple requests for comment. First, I have Sandra, and Sandra, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device. One moment while I find you in the attendee list. There you are.
Thank you so much for allowing us to speak and comment on this topic. My name is Sandra. I work with Alto Pharmacy based out of California. Thank you to the committee for drafting a proposed definition for mail order. The draft as it stands today in the last sentence reads, U.S. Postal Service, common carrier, delivery service, or any other method or mode of delivery. My questions and comments pertain specifically to the delivery service portion of the statement. I echo what Dr. Crowley said in that since COVID and post-COVID, delivery service has become increasingly appealing to patients across the state. It's allowed us to bridge a barrier for patients attempting to access their meds and to stay abreast of market demands. We know that delivery service has become increasingly appealing across other markets as well. The concern seems like it's particularly to address non-resident pharmacies. We ask that the committee consider how this definition may impact in-state pharmacies. Delivery services are primarily for in-state California pharmacies serving California patients. We don't anticipate that pharmacies out of state will deliver into California via courier service. We also ask that the committee consider how this differs from current payer definitions of mail order, which has purely considerations of distance of greater than 50 miles from the dispensing location. Adding delivery service to the definition will cause confusion in how community pharmacies in state are currently classified, as it will differ, 1, with the State Board of Pharmacy, and 2, with payers. Thank you.
Thank you for the comments.
All right, this is the moderator. Next, we have Lindsay Gullahorn. And Lindsay, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Hi again, Lindsay Gullahorn with the California Community Pharmacy Coalition. And once again, thank the committee for the discussion on this issue at the last meeting. We all know mail order is an essential service for patients, both in terms of access and convenience. Echo Board Member Crowley's and Barker's questions with the proposed definition. Have some concerns with the last sentence because we think it may cause some confusion, as it defines a mail order pharmacy as one that delivers or ships to more than 75% of the prescriptions to patients in any state. Curious what the rationale was for the 75% threshold, and concerned that there could be some unforeseen consequences of this, especially from the reimbursement perspective, even if a time frame is included. So would encourage maybe some more looking into that issue. Do, however, appreciate, again, the board examining this and think that the sunset report is an appropriate way to continue the discussion. Thank you.
Thank you for the comments, Lindsay.
Right, this is the moderator. Our next request for comment is from John Gray. And John, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Hi, good morning. This is John Gray, registered pharmacist, Kaiser Permanente. Thanks for the opportunity to comment. Although actually previous commenters have already addressed the points we wanted to speak to. So I think I'll end my comments now. Thank you so much.
Thank you, Dr. Gray.
All right, this is the moderator. Appears there are no further requests for public comment. Would you like me to close that Q&A panel? Oh,
Please. Thank you, Sarah. Okay.
I apologize.
well,
We actually do have one more
okay,
request
go
that
ahead.
just got in from Stephen Gray. And Stephen, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Yes, thank you again for the opportunity to comment. My first comment is about making sure that this is just a definition, and as the president indicated, it will be the basis for regulation, perhaps, of mail order pharmacies differently than for non-mail order pharmacies. So the first consideration is to consider how this also interacts with the definition we just discussed about central fill pharmacies. Also, the very good point was made earlier. How does this affect specialty pharmacies, which often are all of or almost all of what they produce is delivered? And when it says in the last sentence, or excuse me, next last sentence, or any other method of delivery, does that include if the pharmacy has its own delivery process? In other words, it employs people to drive the prescriptions and deliver them to whomever they're intended or for someplace. Is that so encompassing that it would include that as a mail order pharmacy under this definition? And then I think it's really good to talk about the 75%. Is that if 10% of a non-resident pharmacy of their business comes to California, they wouldn't be classified as a mail order pharmacy, depending on how you interpret 75% of what. And so there's a lot of real deep thought that has to be given for definitions, because they are the basis of all regulation. And those are just a couple of ideas that popped into my head. Thank you very much.
Thank you, Dr. Gray. Really appreciate that comment.
All right, this is the moderator. Appears there are no further requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Again, a very excellent points, excellent discussions, excellent comments from the public. Thank you all. I do believe that this was just one of those potential starting point of how we can better regulate non-resident pharmacies, and maybe that after hearing some comments, I think there's maybe better different avenues that we can explore instead of defining mail order pharmacy. But I will work with staff and bring something back for next meeting on this topic as well. Jesse, your hand is raised, so go ahead.
Yeah, thank you. I just wanted to thank all the commenters. I think that last point too of the percentages that Dr. Stephen Gray made was a very good point, in that if only 10% of a pharmacy's prescriptions are actually delivered to California, they may not qualify. And I think moving forward, we could probably look into some of the national definitions of mail order and how payers also define mail orders, so we can kind of have a starting point as a basis for the definition.
Right. Yeah, absolutely. All right. With that, we're gonna press forward, as I think we're actually moving faster than I was worried about we're gonna be. So we're gonna move on to next agenda item 7, and maybe take a quick break at like 10:30 or so if we have depending on how far we are. So we're gonna go for next agenda item 7, discussion and consideration of pharmacy technician training program requirements. Again, a very interesting topic. The meeting materials detail relevant laws and regulations regarding pharmacy technician training programs. As discussed in the materials, There are various pathways to licensure for pharmacy technician applicants, including completion of a pharmacy technician training program that meets specified requirements detailed in the regulation. The meeting materials describe some of the different types of pharmacy technician training programs, including those that are accredited by ASHP and employer-based training programs. Board staff have identified some issues with employer-based pharmacy technician training programs. Staff have brought this issue to the committee for awareness, but also to allow us to consider if additional parameters are necessary to address some of the common issues identified. In addition, staff are bringing forward for our consideration potential changes to the statutory definition of pharmacy technician trainee, which I believe is extremely important. As we begin our discussion, I would like to thank staff for bringing this issue to our attention. I'm concerned by some of the common issues staff have identified. As I open up for this discussion, I would welcome your thoughts, and I'm interested to see if you share my concerns as well. I believe one potential solution, again, we don't have to go this route, but is to require employer-based pharmacy technician programs to be accredited by ASHP. Also, I don't want anyone or anything to hinder a pharmacy technicians to be out there. We have significant issues, I think, with having enough pharmacy technicians, as our licensing stats would show. There's the definite decrease in pharmacy technicians. I don't want anything to hinder that either, so we need to just approach this issue very carefully. With that in mind, I'm open to hear suggestions and your thoughts on this issue. Of course, it's important for us to have pharmacy technicians that are well-trained, well-educated, but also realizing that they are essential to helping pharmacists to work. And, we really need to also make it easier and make it more possible for anyone to be pharmacy technicians who are willing and able and who has met minimum requirements. So lots of layers and avenues. With that, Jesse, your hand is raised. Go ahead, Jesse.
Thank you, Sung. Yeah, I mean, in the materials, it kind of highlights it, and I know I've mentioned it a few times, but just from my own personal experience, the employer-based programs have varied drastically in quality. I would say that there needs to be more oversight on the programs themselves. So whether we decide to go down an ASHP certified route or something else, I think there definitely needs to be some overhaul. Just from the pharmacist perspective and signing off, as a PIC or as a staff pharmacist, you turn to your employer thinking that what they're telling you is correct in terms of the program. You follow the guidelines and you sign off understanding that or with the impression that the program that exists is something that meets the California State Board of Pharmacy standards. But knowing that as an individual, you actually have no control over that. That program is run from like the corporate level. And so just as an example, I've definitely witnessed people become licensed technicians, but really only have experience in training doing clerk work and no actual hands-on technician training whatsoever. And so I think that we need to come up with some sort of overhaul or oversight with the program. What that looks like, I'm open to, but I think that discussion is really important moving forward to make sure that we actually do have quality technicians licensed in our state.
Thank you, Jesse. Any other comments? All right, I'm gonna go to public comment on this. I would hope that we would have some feedback and some suggestions as well as thoughts from the public on this issue. So please share them, and we're ready for public comments.
All right, this is the moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand icon. And audio-only participants may raise their hand by pressing *3 on their device. I'll pause a moment to allow the public time to access these features and submit their requests. All right, and it looks like we request for comment from Stephen Gray. Stephen, you will be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Thank you again. It's very important to realize that when we talk about pharmacy technicians, California is unique across the country. Pharmacy technicians in California, you get that designation and it gives you the authority to do specific tasks. And across the United States, in almost every state, anyone who's not a pharmacist or an intern pharmacist is called a pharmacy technician. And so it's and some of the employers that are nationwide have very good training programs, but their training program may focus on things, on tasks that are not required in California to be one of the tasks that are only done by a pharmacy technician. So you need to start with looking at the tasks that California law says can only be done by a pharmacy technician versus some other unlicensed person. That's very important to keep that distinction in mind. In California, we allowed employers to have their own programs so that pharmacy technicians were not, you didn't spend a lot of money and a lot of cost to the public in training pharmacy support personnel to do tasks that weren't required to have a technician license. So for an example, Oregon had a problem for years in that their law required ASHP accreditation, and ASHP accreditation required sterile compounding training. And 80 to 90% of the pharmacy technicians in Oregon did not work in sterile compounding pharmacies. So it's very important because unnecessary training is also an unnecessary cost that eventually goes back to the public and so forth. So that's very important to keep that in mind. I don't know what the number is, but I would guess that 80 or 90% of the licensed pharmacy technicians in California work in community pharmacies, certainly a lot in hospitals, certainly a lot in specialty pharmacies and so forth. But the tasks they are required to do don't require. At a national convention in Dallas that I was an invited speaker at, they did a big survey, and the number one thing that community pharmacies wanted pharmacy technicians to be trained on was billing. In other words, that was what they wanted support for someone to do the billing. In California, you don't have to be a pharmacy technician to do billing and to do a lot of other things that really are not directly related or materially related to quality and so forth. I'm not saying they're not important, and that's going to get even more important to realize that with the passage of 317, where pharmacies are going to be billing for clinical services, not necessarily anything to do with dispensing a prescription. Thank you very much.
Thank you for the comments, Dr. Gray.
All right, this is the moderator. Next, we have Mark Johnston. And Mark Johnston, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
Thank you, committee. This is Mark Johnston with CVS Health again. I wanted to support what President O said. Simply going with ASHP, looking at it on its surface, California requires 240 hours of training. ASHP is a minimum of 400 hours of training. And there's a cost for every person who goes through ASHP training that you pay to ASHP. So these are barriers to becoming a technician just on their face. But I also want to support what Dr. Gray has just said. I think you probably need a presentation from ASHP to explain what their training is and then compare it to the duties in California of a technician. You know, the duties of the primary duty of a technician in California is count and pour. Many of the training components of ASHP are things that non technicians, unlicensed personnel in California can perform and really wouldn't be appropriate to be required of a technician. So I think there's, more education that could happen on this point. Thank you for the time.
Thank you for the comments, Mark.
All right, this is the moderator. Next we have Sandra Guckian. And Sandra, you'll be given 3 minutes to speak and a 10-second warning. Please click the unmute me button when the prompt appears on your device.
This is Sandra Guckian, Vice President, State Pharmacy and Advocacy with the National Association of Chain Drugstores. Very much appreciate the committee's time and consideration for the comments we have to offer today. Because the literature strongly supports technicians safely performing expanded non-judgmental duties without specific credentialing or extensive training, accredited training programs are unnecessarily burdensome for pharmacies looking to improve the health of their patients. While we strongly support technicians being appropriately trained for assigned tasks, we believe that the employers are in the best position to decide what is necessary for their technician workforce in that particular pharmacy setting and provide that training. Employers can and should have the option to determine appropriate setting-specific training and deliver such training internally. All pharmacies should be allowed to utilize pharmacy technician training programs that meet the specific needs to best train their employees and provide optimal pharmacy care. National accreditation is not only cost prohibitive for the employer, the requirements beyond basic competency standards will force technicians to train and employers to provide training far exceeding what is necessary to effectively work in the retail setting. Furthermore, we do not believe there is any evidence that mandating national accreditation for these programs will improve patient care in California. Eliminating access to programs that are not accredited will leave a critical gap in accessible and affordable employer-based training for future technicians in the state. Thank you very much. Have a good day.
Thank you for the comments, Sandra.
All right, this is the moderator. Appears there are no further requests for public comment. Would you like me to close the Q&A panel?
Yes, please. Thank you. All right, members, any suggestions after hearing from public comments? Any thoughts? Please feel free to. Okay, Jesse.
Thank you, Sung. So I agree that we need to look further into whether or not a national accreditation is the most appropriate route, specifically if it does require sterile compounding and just thinking of the cost to employers. I do think we should continue the discussion though about what the requirements are, although I agree that each employer can decide what training is most appropriate for their employees. At the end of the day, we have to establish a baseline for licensure for the state of California to become technicians. And I think we need to figure out if we are accepting that standard or meeting that standard if there's no proper oversight. So I don't know if there's a way for there to be auditing from the board or if there's an alternative that we can discuss moving forward. But I think keeping this discussion ongoing is going to be important.
Sounds good. I'm sorry, Anne, I'm gonna put you on the spot. Can you just, Anne, from your experience, just share with the members of what you have experienced, anything that you want to share with us, just so our members can have some ideas. And I think the presentation possibly as suggested by one of the public comment on ASHP would be helpful, but anything that you would like to share? Because I know that this topic is a little bit newer to our members. So just go ahead and share your comments and we'll move on to the next one. Go ahead, Anne. I think there's an audio issues there.
Hi, this is Ann. Can you hear me?
Yes, we can hear you. Slight echo, but
Sorry if there's an echo.
we're gonna have to fine tune that audio setting in that room.
So I think the meeting materials detail out a number of the issues we have identified.
Okay.
Listening to the conversation, you will notice in a agenda item we have yet to cover that the board will be undertaking an occupational analysis of the pharmacy technician licensing program. It may be appropriate to consider awaiting the results of that occupational analysis to help inform the committee of the minimum requirements for a pharmacy technician license. I think it's important to remember that a pharmacy technician license is not a pharmacy-specific or site-specific license. Rather, the license allows the individual to perform any of the tasks established in the law. Thank you, and apologize for the echo.
That's okay. Thank you, Ann. I'm sorry. All right. Okay. So always something with the technology, I tell you. All right. I think we got one last item, so I think we're just gonna plow through it if members are agreeable. So we're gonna move on, and then definitely we'll bring this item back for next meeting. Maybe I include a couple of presentations. Although I do think that there's an opportunity, at least on the basics of defining pharmacy technician trainee, in my humble opinion. So I would like to continue to work on that. I think we have an opportunity to broaden that at least. So hopefully there's a little bit more pathways as well for pharmacy technician trainees to be trained. So I'll work with the staff on that aspect. All right, next agenda item 8, discussion and consideration of proposed amendment to California Code of Regulations, Title 16, Section 1793.65, related to pharmacy technician certification programs approved by the board. Another pathway to licensure as a pharmacy technician is certification by an agency approved by the board. The board's regulation 16 CCR section 1793.65 lists the 2 programs currently approved by the board, which are the Pharmacy Technician Certification Board, or PTCB, as many of you know, and the National Health Career Association, or known as EXCPT, EXCPT exam. Section 1793.65 also includes a sunset date of December 31st of 2024. Absent action by the board, the regulation will be repealed on that date. As the meeting materials highlight, the board needs to evaluate the examinations used by these 2 entities consistent with the Department of Consumer Affairs licensure examination validation policy. The board has contracted with the department's OPES, Office of Professional Examination Services, to perform the work necessary in compliance with the department's policy. However, that work will not be completed in sufficient time for the board to consider the results and promulgate regulations as appropriate based on the findings and subsequent board action. Given the timing, I agree with the staff recommendation to secure an 18 months extension at least minimum of the sunset date. Such action will allow for the continued use of these 2 certification programs as a pathway to pharmacy technician licensure while the work is being performed by OPES and any subsequent regulation change is promulgated. While this 2-step process is unfortunate, I believe it is necessary and appropriate to ensure applicants can continue to avail themselves of this pathway to licensure, which is critical. The draft language for our consideration is included in attachment 5, along with the DCA licensure examination validation policy. Members, I welcome your thoughts. No comments can be just incorporated as you agree, but please share your comments as you desire.
Hi, Sung. This is Jessie. I would make the motion to recommend initiation of the rulemaking as stated. Should I read the whole thing?
I think
in
per
the material?
our Council Noreen just
Yeah. Okay, so I'll recommend the initiation of a rulemaking to amend California Code of Regulations, Title 16, Section 1793.65 as proposed to be amended, and authorize the executive officer to further refine the language consistent with the committee's discussion, and to make any non-substantive changes prior to presenting the proposed rulemaking to the board.
Thank you, Jessie. And any second?
Hi, Song, it's Jason. I'm happy to second.
Thank you, Jason. All right. With that, we'll open up for any other comments, Renee? We'll open up for public comment.
All right, this is the moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen, or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. And it looks like we have a request from Stephen Gray. Stephen, you'll be given 3 minutes to speak and a 10-second warning. Please click the Unmute Me button when the prompt appears on your device.
Thank you again. I absolutely support the passage of this motion now. It is very important that whatever is done with the training and the previous discussion, that may take longer than by December 31st of 24. So please do go ahead with this. However, it also presents an interesting idea that perhaps the 1793.65 could list additional organizations. And when the board seeks more information, they should seek information about who else could qualify for recognition of appropriate certification training for pharmacy technicians for what they do under California law. So if California law has a significantly different set of qualifications or a significantly different set of authorities for pharmacy technician, then perhaps the board could encourage an organization, perhaps like the California Pharmacist Association, with establishing an accredited program that recognizes and differentiates itself from the national that is specific to California law that the Board of Pharmacy would accept. That's just one idea of going forward. With that comment, I agree this should be approved right away.
Thank you for the comments, Dr. Gray.
All right, this is the moderator. Appears there are no further requests for public comment. Would you like me to close the Q&A panel?
Yes, please. Thank you so much. With that, we're ready for votes. Yes, Renee?
Yes.
Thank you, Renee. Jessie?
Yes.
Thank you. And Jason?
Yes.
Thank you. All right, we have one last thing. It should be really quick. We're just and we're basically done for the day. So next agenda is discussion and consideration of licensing statistics. The meeting materials include a summary of the licensing statistics for the first 6 months of the fiscal year 2024. The board has issued 5,119 licenses to individuals, 382 site licenses, and 207 temporary site licenses. Processing times vary. A review of processing times again shows improvement in several areas. The data report reflects the oldest application of each application type. I highlight that only to remind members that the board's average processing time is shorter than what is reported. As was projected, with staff vacancies being filled and onboarding, processing times in several areas of operations have improved. As a committee, we will continue to monitor the progress made by staff. I would like to again Sincerely and publicly commend our licensing staff who have demonstrated great commitment to applicants during this time, many of whom are taking time away from family and friends, working overtime to address these backlogs. A big thank you to our licensing staff. We appreciate you. Members, I would welcome your thoughts if you have any thoughts. And we're ready for public comment.
All right, this is a moderator, and at the direction of the committee, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your WebEx screen or use the raise hand function. And audio-only participants may raise their hand by pressing *3 on their device. And it looks like we request from one of our call-in users. Call-in user 8, I will request to unmute your microphone. You'll be given 3 minutes to speak and a 10-second warning. I believe it's going to be *6 to unmute yourself.
Hi there. Can you hear me all right?
Yes, we can.
Okay, great. Yeah, I had a question in general about what is Board of Pharmacy's involvement in ambulatory surgery center regulation of all their controlled substances, or just overall regulation of pharmaceutical services in California. And that was a question that I had, and I also, because I do some consulting for them, and I just see the controlled substances, it's so loose. It's just last week I was in, and I see the anesthesiologist taking 2 vials of fentanyl. In the OR notes, it says I used 150. There is no documentation of the remaining 50. It's a 100 microgram vial that he used 2 vials. There's no documentation of the 50 micrograms that was wasted or signed for. And then in the anesthesia notes, it says 2 vials were used. None. This has been going on. I'm going to go back and look 5 years in the past just to review some of the charts. Or, for example, I went into another center, plastic surgery, and the office manager said, "Oh, well, I have some fentanyl inside the office." And we went in her office, and she just opened it and had some of the controlled substances that need to be locked up. And in that case, I just think she just doesn't get the severity of, these are highly controlled. You can't just leave it in your office and leave. And so I'm noticing it's just so loosely controlled, and I wasn't sure if the Board of Pharmacy is actually involved in surgery centers, and to have it mandated to have a third party come in. Nevada has it once a month. I know that the regulatory agencies such as AAAHC does require it every quarter, but those centers seem to say, well, they have never asked me, so we're okay. We don't need someone. And I had raised this question before I actually came to a Board of Pharmacy meeting, and then it was I never heard anything back about how do we do this. At that time, it was about pulling medications unlabeled and leaving it on the tray that we found, and we don't know what it is. It was just, there just seems to be, there's a lot going on within them, and the pharmaceutical services looks like it needs some support, to say the least. And then, so I'm wondering if the Board of Pharmacy can regulate something somehow. And that's it. I'm complete.
Thank you for the comments. I highly encourage you to contact our staff at the Board of Pharmacy, and then they can bring that discussion back to us. So please reach out to our staff, and our contact us section of our website has all the information necessary.
President O?
Yes.
Apologize for the echo. The individual may also want to participate in the Enforcement and Compounding Committee meeting tomorrow.
Sounds like a great suggestion. All right, and I believe I did not verbally voice my vote for last agenda item, so I vote yes on the last agenda item. With that, members, thank you for a great day. I appreciate all of your time and commitment as always. And before we adjourn today, I would like to thank everyone for your time and participation. Our next meeting is currently scheduled for April 10th, 2024. Please monitor the board's website for any updates. We have a lot of items to bring back for next meeting, so it'll always be more fun to come. So thank you all for always your hard work, and we'll see some of you tomorrow, and we'll some of you in a couple weeks. Thank you, everyone. Have a great day. The meeting is adjourned.